Hey, Jeff, what's up?
I really appreciate everything that you've done. I've been listening to you for about 6 months now.
Cool. Well,
and made some changes that you recommended. Just recently put myself on berberine. I'm a 60-year-old man.
Good.
Recently had a blood test and came up with a little bit high on the cholesterol. And I'm eating very healthy. You know, I eliminated a lot of the carbs, eliminated a lot of the red meat. So I took your advice and got on 500 milligrams of berberine just to start off and see how that goes.
Go twice a day with it. You'll watch the triglycerides drop. To bring the cholesterol down, I would add folic acid dosage 5,000 micrograms a day, and then things will start to fall into place where they need to be. The 5,000 microgram dosage sounds like a lot. It really is not. It's not expensive if you buy it right, and that's pretty much how you do it. There are a couple other tricks you can do, but you're well on the way. But Jeff, what's on your mind?
Well, when I was at the doctor, I've had a rash on my face for a couple of months, and it turned out to be rosacea.
Rosacea? Okay.
Yes. And I went to a dermatologist, and that's what he diagnosed it.
Okay.
And I was wondering if you had any recommendations. He had prescribed doxycycline.
Okay, okay. He's giving you a topical antibiotic.
And a cleansing gel as well.
Piece of cake. That's a good place to start with it. Okay, when that works, it works beautifully. You know, typically the way I like to do it is to use a compounded transdermal that has an anti-inflammatory as well as an antibiotic. Okay, and that tends to be a little bit better, a little bit faster. Here in Florida, you have to be careful because you can end up with it's called a photosensitivity reaction, but it works real well. An alternative to that works a little bit faster, but it's kind of an uncomfortable sort of thing while you're doing it, is something called IPL, which stands for intermittent pulsed laser. And you essentially burn the skin. Okay, you go zap, 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 zap over the area of your cheek and nose, and that usually takes care of it, and it does it quickly. Okay, it's not terribly expensive, but it can be. You're a few days down because you look like do you ride motorcycle?
No, I do not.
Okay, if you did, they'd call it road rash. It's what happens if you hit the deck at speed. It makes the skin look as if you've been burned because you have been. But the topical antibiotics are appropriate.
Okay.
But if you mix them with topical anti-inflammatories, it works a little bit faster. And if you fail that, going ahead with an